Hi, it's David again. This time we're going to be talking about cataracts and eye health. As you can see in this cute pooch here, even he can get cataracts. It's a very natural thing that occurs with time. Um, like the last video, it's also a very chronic condition to occur. So we'll talk a little bit more, a little bit about the eye first, yeah, in order to understand kind of the baseline for cataracts. So here's the eye, the anatomy of the eye. So we have here the cornea. This is a clear layer that protects the eye, and this actually is amazing. It's this it doesn't have any antibodies, so it's something that we can transplant very easily between people. Sometimes when you have organ donation, one of the things that they might take from a deceased patient is their cornea to transplant to someone else. It also heals extremely fast. It's another one of its perks. Here we have the iris. It's a colored muscle that kind of has a hole in the middle for the pupil. Now, the activity of the iris, whether it contracts or dilates, makes the pupil contract or dilate. It increases or decreases the size of this hole so that it can regulate the amount of environmental light that gets in through the pupil. The iris also can be colored. This is a colored portion of your eye. For example, my eyes are brown. That just means that the pigmentation of my iris muscle is brown. But whatever color your eyes might be, that actually doesn't affect your vision in any way. Then we have the lens. This is a group of specialized cells that have the ability to bend light in a very specific way to project that image right onto where we want it to go. We'll talk about that in a second. And this right here is the anterior chamber, and this is the posterior chamber. Here, the anterior chamber is filled with aqueous humor, while the posterior chamber is filled with vitreous humor. And these humors are just thick, nutrient-rich fluids that can give the eye shape and the right amount of pressure. The sclera right here is the white covering that goes all around your eye. If you look at yourself in the mirror and you look at your eyes, this is actually the part that you can actually see surrounding your iris. The choroid right here is another layer, the middle layer. It's extremely vascular, has a lot of blood vessels that supply the eye with nutrients and oxygen, all that good stuff. The retina right here is the back part, and this layer right here is where all the photoreceptors are. We'll talk a little bit more about those later on, but this is where basically the information from the environment is translated into something that the brain can interpret. But of the retina, one of the most important places that you want to think about here is the macula densa, otherwise just macula. You might have heard that in macular degeneration. That's a dysfunction of the macula due to maybe something like diabetes. Or even age, actually. It's mostly age. And in the center of the macula, you have something called the fovea centralis. That's the more concentrated area of photoreceptors. And when you have light shining through your eye, all these structures right here are trying to project it right onto the center of that fovea. Then the last part we have right here is the optic nerve. This right here is cranial nerve number 2, and it is the sole avenue through which the eye can transmit any information to the brain. This is actually also the reason why you have blind spots. There are no photoreceptors right here. That means you don't make an image in your brain of any light that passes projects right onto this area. This is the reason why you have to physically turn your head to look behind you when you do a lane change when you drive, because you can't actually see something right here. If you go from your nose and move your hand about 130 degrees left or right, that's where the blind spot is. You'll notice that in the periphery of your vision, your hand actually disappears. You can't see it. Yeah, one of the things that the eye is capable of doing is healing extremely quickly. It's quite complicated, but it is extremely hardy and has the ability to regenerate, heal, recover very fast. One of the things that are important for your physical exams is something called pearl or perla. The eye has the ability to reflexively, intrinsically respond to environmental light. So if you're in a really bright place, you want to let less light in, so your iris will make this pupil smaller. If you're in a really dark place, your pupils get a lot bigger. And that size is also determined by other things like If you one of the common things is if you are talking with someone that you like, let's say like your partner or someone, your family, then your pupils actually get bigger. It's because of a sympathetic response in your body. Um, and right here, perla or pearl, it just means pupils equal, round, regular, and reactive to light and accommodation. It just means that the eye is working, the neural aspects of the eye are working as it should. And pearl is just pupils equal, round, reactive to light. That's what it means. Yeah, it's just another same thing. Um, one of the important things is that your eyes should be equal. Pupils shouldn't be so big on the other and small on the other, like on one and the other. That might mean that there's some sort of problem with the pressure in your eye, or maybe there's a nerve damage from to one eye. Yeah, if you're unconscious, even if you're, let's say, sleeping, if there's a light shined into your eyes will actually still respond to that accordingly. But if someone is deceased, maybe, and their neural functions are not intact, then that kind of reflexive change in the pupil, in the iris, might not occur. It will not occur if they have died. Um, Damage to the optic nerve is pretty serious. So, for example, in glaucoma, there's increased intraocular pressure in the eye that may displace the optic nerve. Or, if there's trauma, or if there's maybe an infection, any kind of injury to the optic nerve that severs it or damages it, that could cause a permanent loss of vision. Because, like we said before, this is the only avenue through which information from the eye gets to the brain. The last thing we'll talk about before we get into cataracts is how light travels from outside to the inside of your eye. You have an object right here, and light from maybe the sun or a light fixture bounces off that object, and it gets into your eye through the clear cornea, through the lens, which is a biconvex structure, and projects the image like this right into the back of your eye, right, hopefully on top of the macula densa. This is the pure and only function of the lens. If let's say it can't do that because if your eyes are a little bit longer, if this eyeball is elongated front and backwards, then this image might actually be projected right in front, like here. That would mean that this image comes out blurry, and that's actually what we effectively call nearsightedness. So having glasses, an external lens to correct for that, is the reason why we wear glasses. Same thing, if this is flattened, if it's front and back, not as long as this, the image might be projected back here. And that's the same thing. It's going to give you something blurry, and you're going to need different types of lenses to correct for that error, I guess, as well. So when we talk about the macula densa, why it's so important is because right there we talked about the photoreceptors that it's housing. These photoreceptors are specialized receptor cells that are capable of taking in information from the environment, namely from the light, and encode it into nerve impulses or electrical impulses through the optic nerve to the brain, so that it could be interpreted by areas like the occipital lobe or the visual cortex. So these are called rods and cones, and rods are dark and black and white vision. Cones are color vision and lighter vision too. Yeah. Cones are really special because they, there's a lot of different theories for how we might see color, but one of the prevailing ones is called the trichromatic theory. And the idea, you don't have to really know what that is, but the idea is there are three different types of cones: red, blue, and green cones. And they work together to give us all the colors that we can see. Every color that we can possibly interpret or perceive comes through the combination of those three cones. One thing to note here is that red cones are tied with the X chromosome. And from genetics, you know that men are XY and women are XX. So an XY male, if they have a dysfunction in their X chromosome, they don't have another one to kind of back it up. So that X chromosome dysfunction in the red cone could cause something called red-green color blindness. This is more common in men than women, and it's actually it is the most common type of color blindness that there is. Um, and conversely to that, actually, because women have two different X chromosomes, one of the special things about red cones is that it comes in two varieties. They're slightly different reds. So having two different reds, blue and a green, could actually uh, give some women the ability to see color with much greater complexity than maybe I could, or a woman who doesn't have two different types of cones, red cones, can perceive. So that's something to keep in mind. It's a really interesting side bit here. And the last thing to talk about here is you might have heard of something called astigmatism, and that's just a deformity in the shape of the cornea. So there might be bumps or dents or little deformations in the cornea, and that could affect the way that light travels to the back of the eye, like here, like this. If you're really mild astigmatism, that could just be a little bit more of a blurry vision thing, or you might see small shadows. But if it's really severe, you could even see double vision. It's something that you can correct for either with surgery or with glasses or contacts. So let's talk about cataracts now. Over time, what happens is that lens that you had could cloud and start to distort your vision a little bit. It could blur your vision or take away the color in your vision. This is pretty intimately tied with aging. You're not going to see really anyone younger with cataracts, but it's very, very common in older people. Every other American over the age of 80 had to have dealt with cataracts in some way in their life. So, yeah, very, very common, and it could occur for a variety of different reasons. But the thing to note is that it's kind of due to wear and tear and the dysfunction of the normal mechanisms of your body, of your eyes, really. Um, One thing to note here before we move on is the word secondary. You might see this. You might have seen this before when you're scribing with your provider, but secondary is just a term to describe how something came out of something else, essentially. So when you say cataracts secondary to diabetes, it means that diabetes was a pre-existing condition that led to the complication of cataracts. So diabetic retinopathy is also secondary, typically, to diabetes. Well, it is. And glaucoma can also be secondary to diabetes as well. Yeah, it's another really good word to know. So the different types of cataracts is not super important to know. You should know, I guess, the one that's associated with aging, the more common type of cataract is a nuclear cataract. The, the, the cloudiness starts from the kind of center of that sphere and goes outwards. But no matter what kind of cataract you might have, if you have it for long enough, the entire lens will be clouded to a point where you can't really see very well, or you can't really do this very well. This is what's important. The lens is focusing that light and projecting it right into the macula densa. But if you have a cloudy lens, that process doesn't really work, and you have a scattering of light instead. This is actually very similar to what's the reason why our sky is blue. There's something called Rayleigh scattering, and light comes from the sun, hits the atmosphere, hits the ozone layer, and it gets scattered, just like this. And nitrogen particles in the atmosphere absorb every color but blue from that light and reflects that blue back to us, and that's how we see the blue in the sky. So this scattering, imagine this is the ozone and this is the light coming in from the sun, and this scattering is causing a blurriness in your vision. So if you want to get diagnosed for cataracts, you have to see an optometrist or ophthalmologist. Ophthalmologist is just a fancy term for eye surgeon. There's going to be some sort of change in your vision, usually lack of sharpness, maybe a lack of color. You're going to need glasses, maybe. And they're going to do a variety of different things to try to see, these are also things that you do typically in your annual visual checkup. Visual acuity test is just the chart with all the different letters, the small ones. Well, what is this? Is this A, G, K, whatever. The dilated eye exam, that's that highlighter fluid thing that they put into your eye to dilate it. to see. You can get really sensitive to light, and they gave you that little plastic sunglass thing. Tonometry is that little puff of air that they put into your eye to measure the pressure of your eye. You don't want it to be too high or too low. But all of this will probably most likely be done already by a patient who comes in a visit, because you're going to have to do all these things and more to know that you have cataracts and to know what kind of cataracts you have and what you can do about them. So I think when we talk about the context of our clinic, you're going to probably see patients that come in for pre-op. They got to get checked off by one of our providers saying that they're physically fit and ready to get this surgery done. So one thing to note here is cataract surgery, eye surgery, is a really scary phrase. People kind of get nervous when they think about something like this if they don't know, if they're lay people of medicine. But really, cataract surgery is one of the most unbelievable achievements of modern medicine. It's extremely fast, 15 minutes maybe tops. Very, very common because of how many people have cataracts, and it's extremely safe. It's very hard to mess this up. What they do is they make a small incision on the cornea, and they use a vacuum to suck out the old lens that you had in there, the cloudy ones, and they put in something called the intraocular lens. They put in this artificial lens to do what the old lens had done, but better. And they stitch up the cornea, and that's really it. Very, very simple, very fast, very easy. That's the process of having a cataract surgery. But if you did both eyes at the same time, you would effectively have somebody who's visually incapacitated. So you do one eye at a time. You typically, I think the worst one goes first, and then the other one. You got to do the first one, and then wait about 4 weeks or so to let that eye heal, and then you got to do the other one. And before and after, you got to prep, and you got to kind of take care of your eye after with eye drops. After your surgery, your eye is going to be inflamed, and having some certain eye drops will let that inflammation go down. It'll help decrease the risk of infection and overall help the healing of the eye. So yeah, I think that's it for this one. Like I said before, cataracts are really a product of time, and just like the last video, it's something that happens with age, which is why it's something that I think we should talk about in context to Curry Senior Center. I think that's it for this one.